Hi, everyone. I'm Tammy, Brook, founder of FYI Brand Group. I couldn't be more honored to present today's panel. We have a group of extraordinary thought partners, thought leaders in social justice, civic engagement on this panel. These women are all leading the charge in advocacy as we know it. We are so excited to announce our partnership with Mike, who is there powering this information you'll all be learning in real time. So thank you, Shanté, for joining us for this. Without further ado, I just want to explain why we're here today. We realize that as an agency that sits at the intersection of pop culture and social justice, it was our duty to share the information we were learning from experts in the field of social justice and social advocacy in real time. We're learning what's working, what's not working. We're trying to create an inclusive environment as we all are across the globe and are in rapid response now.
Tammy, thank you so much for the thoughtful and beautiful introductions and for organizing this panel series. This feels full circle to me too. I'm looking around on the screen. I see friends, I see leaders that I deeply respect, and I feel really humbled to be a part of this group having this discussion this evening. Hello, everyone to whom I can't see and who I have not met. My name is Monique Dorsonville. I lead progressive engagement at Facebook and just really, really pleased to spend the evening with all of you. I do have to admit, I have not left my home all day. So it's an understatement to say that I'm excited to be in community with you and to hear from this dynamic group of women, many of whom I had the chance to work with in President Obama's White House. And these are women who are leading some of the most important advocacy efforts across the country. A little bit about my team at Facebook. We work with advocacy organizations, think tanks, civil and human rights organizations to really broaden the discussion around tech policy issues. So supporting third-party efforts and also serving as a conduit for two-way feedback to make sure that Facebook is making sure that our policies land in the right place around tough issues like content moderation, privacy, encryption, and election security. We are in the month of May, so I do want to lift up that it is both Asian American Awareness Month and Mental Health Awareness Month. So I think those are two really important things to hold as we start this conversation with so many people struggling to balance mental health and social isolation. And then we're simultaneously just seeing the rise of coronavirus-related discrimination towards the Asian American community. There's a recent FBI report that outlines this in detail.
So the biggest thing that keeps coming up in a lot of the conversations that I'm having with immigrant families and a lot of members of the Latinx community is 9/11. No, everyone, many people have told to me, this is our 9/11. No, and I think that's because the level of pain and trauma, right, as this is Mental Health Awareness Month, it couldn't be more important to talk about this because the level of pain and trauma that the community is undergoing right now, I think is something that they've never experienced ever before, no? And so that word 9/11 has continued to come up. And so my biggest insight right now, and again, I'm talking to you all from Brooklyn, not from New York. This is the epicenter of the epicenter. You know, Latinos here are dying at higher rates than anyone else. I believe that the Latino unemployment rate across the country is the highest one right now. So that just to give you a sense of like the trauma, no, that's at the heart of the community. And what I've been noticing a little bit, even this is just based on my conversations in New York City, right, is that trauma among the Latinx community looks very different right now. You know, surviving this pandemic, if you're Latina right now, can look many different ways, right? And that's something that mainstream media doesn't necessarily always get right. No, obviously we know that they tend to paint us as a monolith, but survival and trauma from my experience in New York, and I'm not even talking about every other conversation across the country, here I can tell you that it's very different. Wives that have lost their husbands to COVID, and what's on their mind right now is that they can't afford the funerals, no? And their husband's biggest wish right now is to send their bodies over to Mexico because it's part of their tradition, no? So they can't afford to sort of let go of their families with dignity, no? And as we're talking about mental health, another thing that keeps coming up is this idea of like survivor's guilt. No, so many Latinos that are surviving the virus, no, that find themselves in hospitals with people dying around them, no, with family members dying, and they survive. So what does that look like? No, there's a lot of guilt there. So I think my biggest insight right now is that surviving and trauma among us looks many, many different ways. And it's just important for us to have that in mind, and to keep that in mind as we're having this conversation. And just for the audience, because when we're thinking about how to help, all of that will depend on how we understand what pain looks like right now.
And Kailee, one thing that I love that your team said is, we are the essential workers. We are the mail carriers. We're the delivery personnel. We are the transportation providers and the hospital workers. We just can't stay at home, similar to the example that Paola gave. So can you talk to us a little bit more about the work that you're doing to lift this issue, including how you're putting pressure on folks to release the data?
Yeah. Yes, thanks for that. As you said, this pandemic has really just exacerbated all of the things that we've already known that we've been fighting for decades. We've been fighting health inequality for decades. We've been fighting in economic injustice for decades. And so a lot of these issues, again, are just more pointed and more poignant during a time of a pandemic when we are stripped to our core. And so a lot of people are talking about business as usual. We have to get back to business as usual. Well, we don't want to get back to business as usual, because business as usual is what got us here in the first place. Business as usual is what is having Black people dying in cities at 3 and 4 times their population share, which means if there is 16% Black people in a community, 40% are dying, as we're seeing in places like Michigan. And so it's very important for us to really start to and continue to address these issues, and to continue to bubble them up, and to make sure that people understand that we still have a lot of work to do to repair the damages that have already been done. And we still have to think about how we're providing and protecting our communities as we think about things like testing, and as we think about the vaccination. How are we receiving those? How are our communities gaining access to some of these things? And I appreciate that you mentioned some of what we're doing in particular to make sure that things like data is released. The reason why that is important is because the data will teach us things. We have a lot to learn about this virus. We have a lot to learn about who it affects and how. And we need to know how it affects different demographics. We need to understand why it is impacting the Black community the way it is. As you pointed out, we can't just stay home. We are frontline workers. We have a lot of the pre-existing conditions because of a history of health inequality that has plagued us, that makes us more susceptible to this virus. And we need to understand how it is impacting us so that we can plan around that, so that we can advocate for our own protections, and we can advocate for the provisions that are necessary. So Black Lives Matter has done a few things. Number one, we started a petition that you can access on blacklivesmatter.com, which thousands of people have signed, which is appealing to the CDC to aggregate and release all racial data. And there are different chapters around the network are advocating for specific data within their own communities that will help impact the way that provisions are allocated in those communities. Something else that we did very early on, as soon as this virus became clear the way the virus was going to unfold and the way that it would wreak havoc, is we started a petition to ensure that these stimulus packages address the provisions and protections we need. Things like relief packages that provide massive testing, emergency food and shelter, decarceration, and protection for our incarcerated population, expansion of unemployment, all types of different, very common sense provisions that we need to survive. You can access that as well if you're interested in signing that petition on blacklivesmatter.com.
I mean, we were founded because, it's in our name. History and media have always had a very narrow view of what it means to be American, of who gets to identify as American, and therefore who is treated with that, who is treated and who are those benefits of this idealistic America and those principles, who gets to benefit from that. And so for us, it's critical that definition be completely broken down, and that it be replaced with one that is inclusive of all Americans, no matter how you got here or how your ancestors got here. I think the hard thing with what we do is that so often you hear this narrative coming out of the immigrant rights movement that we are a nation of immigrants. And we really try to shift away from that, because that we find that to be a little bit dismissive towards Native communities, towards Black people who are descendants of the transatlantic slave trade. And so for us, it's really more so about complicating this narrative, not just replacing one simplistic narrative with another simplistic narrative, complicating that so that people can be seen as fully human and fully deserving of all of the rights that some people in this country are afforded, but clearly not all. For us right now, like, we're not a direct services organization. We're an organization that's focused on media and culture change. So for us, shifting the narrative is really important and critical, in that we want to make sure that communities like the undocumented community in America, who are consistently left behind, whether it be through aid or in conversations, are not in this moment. We really want to make sure that the media outlets are lifting up undocumented stories, particularly because so many undocumented people are essential workers.
Thank you, Noelle. I'm curious. So one thing that I hear in the national conversation, sometimes people say that there's no relationship between narrative and what happens in real life. There's no relationship between representation and real world violence. What would you say to that? And can you, for people who have trouble seeing that link, can you just kind of talk through what that relationship looks like?
Yeah, I mean, I think if you look at history, how people are depicted and portrayed in media has a direct correlation with how they're treated in everyday life. Whether it is, if you look at the depiction of Black people in newspapers and illustrations that are coming out of like the antebellum South, or if you look at political cartoons featuring Chinese immigrants during Yellow Peril, or like around the Chinese Exclusion Act in the 1800s, if you look at how in recent years Latinx folks have been criminalized in television and in films as cartel leaders and drug lords and gangsters, those directly impact how those communities are treated. And I think that historically in America, every time there is some type of demographic shift, whether it be European immigrants coming through Ellis Island in the early 1900s, or an influx of Asian immigrants about 50 years ago, or like the more recent influx of Latinx immigrants in the past 30 years, people tend to freak out. And as a result, that fear and that scarcity mindset then results in, more problematic media narratives, which then results in how people are treated, and most often, like, not only just discrimination, but violence, whether it be from the systemic level and from government, or from on an individual level, like with hate crimes. So I would encourage people who don't necessarily see how those two are connected to do a little bit more reading into history and really pay attention to the images that you've seen on television over the years and how those have shaped your personal worldview and how it shapes how you view people when you walk down the street.
The biggest impacts are hitting women of color, and we know that. That has been particularly, as Paola mentioned, Latinx women, and Kailee mentioned Black women, Native women, Asian American women, are particularly in many more chances essential workers. Many people are also having to go to work, and then their kids are home from school. It is an incredibly deep impact on women across this country. And on top of that, we are seeing, as you mentioned, Monique, continued barriers being erected for women and girls. As you mentioned, in Texas, but also in several other states, abortion services and reproductive health services have been deemed non-essential medical services, which means that during the time when we're locked down in terms of healthcare services, women are not allowed to get those. Procedures in many states, right now I believe it's 5 states. The Texas law, thankfully, is no longer in effect, but I think that varies from day to day based on what we're seeing. But it literally could tomorrow change. It happens every day based on court cases. And we are constantly seeing, to your point, domestic violence and sexual assault survivors, which I know Amanda will talk about, really facing continued trauma and continued lack of ability to maybe be able to get those resources that they would have been able to walk out of their homes to get before, or call before, or chat before, if they are living in a home with an abuser. And so we're seeing all of these impacts exacerbated upon women and girls. And I think what we've noted, what we've seen, and what we've all talked about is that these have existed forever. We are just shining a big fat spotlight on that. And it is really important for us to be recognizing that this is stuff that we need to change for the long term. And these are not issues that we need to just say, well, let's slap a Band-Aid on it because of the COVID pandemic. And so at the beginning of the pandemic, the United States of Women, we've always been about connecting, convening, and amplifying the work of women and girls around the country, really helping to showcase what great organizations and individuals are doing on the ground in their communities to help.
And the most powerful tool that we have is our voice. Quarantine may be very difficult, but justice can still happen in quarantine. Justice can absolutely still happen, and organizing can still happen. And so that's what we're doing for survivors of sexual violence right now. You and Jordan and others mentioned it earlier in this event, but there have been many unprecedented things about COVID. One tragically predictable one is the rise of domestic and sexual violence. This is a phenomenon that we've seen in crises like war zones, natural disasters, pandemics, and in particular, this pandemic has ingredients that exacerbate the incidences of sexual violence. So things like widespread job loss, economic hardship, close quarters in quarantine, and feelings of self-isolation, back to that mental health awareness. And so something that my team has done as a rapid response is to partner with brick and mortar places that are still open in communities, lifelines right now, places like chefs, restaurants, grocery stores, and to roll out a program called Survivor Safe Haven. So it's in DC, SFLA, Boston, New York, Memphis. It's still growing. Jose Andres is our latest partner in the DC area restaurants. But essentially there are flyers that are posted that say Rise Up 19, that's the code word. And if a survivor goes into a survivor safe haven, sees a code word and says it, what they know is that staffer is trained to call the hotline and give them a phone and a safe place to take that call. The first goal is access to resources and information. And then the second goal, which is just as important, is to let survivors know that they're not alone. There's a community, there's allies standing strong, ready to help them should they need it.
I mean, when I started Mike about a year ago, I kind of rejiggered our mission. And the way I've always thought about it is just creating, that Mike could be a place where people come to, young people in particular, come to not only just like read the news, but to process the present moment and understand the world through diverse viewpoints. And I feel like, obviously when all of this was happening, I felt I really snapped into high gear because it really felt like the mission was never more vital than in this present moment. I think as editors, we always think like, what does the audience want? And during this time, I think, I'm really grateful to have a really diverse staff, because I think all of us immediately thought, well, how is my community being affected by this? And we were able to, just kind of launch all of our writers and reporters in different directions to, investigate what was going on in their own communities. So, our reporting has covered both how communities are coming together, but also the new unique ways that each of these communities are suffering because of systemic inequalities. So, that's ranged from covering sex worker safety and restaurant to covering restaurant workers, rallying for mutual aid, women's access to abortion being impacted, companies' treatments of essential workers. I think there was also recent news that we covered of undocumented people who are married to undocumented people are unable to receive aid, and we were doing some reporting around that. And it's just, sadly, it's just how every community is being impacted differently by this. And I think, now is the time as a journalist to talk to each of those communities and really try to raise a light to what they're going through, and also, how we can actually impact change. I think that's been the goal since day one for Mike, is to not only be covering these issues, but to be covering them so that they won't go unscrutinized. And I think, even thinking about last week, the media coverage of like Ahmaud Arbery and how that had went under the radar for so long. And just like now we talked to a bunch of like, you know, people in the Black running community about how they're being impacted by this. Just like now during a time when, you know, maybe the only thing that we have, like we were all saying one of our mental health outlets is to be able to like run or take a walk, and then to have this like compounded during this time. So just thinking about like, you know, the different communities are suffering in different ways and trying our best to bring light to those issues.
Actually, the first week I remember jumping on the phone with you and Jake from Mike and trying to figure out what the move was. And I think at this present time, it's a day-to-day thing. So it's one thing you said that was like the driving thought that changed the way that we were strategizing and thinking is, how do we cut through the noise? There's just so much going on, and the entire world is in crisis right now. This is unprecedented times. So for us, what we rely on is you, these women in this room, in the Zoom room right now. We rely on you as our thought partners to take your missions and lift them. So, and find a way, as we see what's happening in the landscape, is so many of your platforms are pivoting to the COVID. So, you know, Rise has the /COVID. And, you know, so we're all working in rapid response, providing real-time resources. And it's actually for us so exciting, because what we're doing is we're staying true to our clients' passions, to what they really believe in and to who they are. So if it was prison reform before, it's going to be, what can we do right now for mass incarceration? Can we help lift nonprofits that are fighting to get decarceration, like Kailee mentioned? So, you know, what are we doing to support what's organic to them within this crisis at this present time? So that is what we're doing. So we were able to, for example, we represent Davido. He's Nigerian. He's an Afrobeat superstar. He immediately went home to Lagos and gave $1.5 million to the government. Clients like Steve Aoki, he has a massive platform. We jumped to the World Health Organization because that's what we were seeing that week, the first week, and we aligned with them. So how we're working is we're working in real time, talking to you and talking to other nonprofits and finding out your missions and what you need now and what can we do to lift for you. We don't want to do our own thing. We want to lift for you. We want to align and lift. So that's how we're pivoting. We have, you know, a client, Tory Lanez, who had a mass following on IG Live. We have 400,000 people at one point, and we knew about he cares about underserved youth. And so we immediately went into where can we provide meals and diapers. Diapers are, you cannot find diapers like you cannot find toilet paper right now. So we found 100,000 diapers to donate to them and launched a fund. So what we're doing is we're listening to you. So every one of you, what can we do to lift? If Kailee, I text her all the time whenever I see the crisis of what I texted you last night. And you said, no, we're already on it about, you can talk, Kailee. The 2 times I've texted you and we've been lifting, you know, the trauma of, you know,
Rihanna and Ahmaud, yeah.
Mm-hmm. Ahmaud Arbery, it's just been tragic. What can our celebrities that have millions and millions of followers do to lift your narrative, what you need to do? And I love the call to action graphic you created. It was simple and to the point about Brenda. So it's what we rely on you. Give us the assets. We're going to help you lift every day. So keep doing that. Keep telling us what you need.
Now I feel like it's a time where we all need to be most vulnerable. And to me, that means that each of us should find ways to tell our stories. Obviously, that's my goal every day, to help people tell their stories. So if you ever want to reach out to me, or you know of a community that's being impacted that we haven't covered or is being ignored by the media, definitely let me know. And yeah, read Mike.com for all of these wonderful stories that we're telling, because we're really just making such a big effort right now to make sure that, you know, we're telling the stories that are going untold.